It's recording. Okay. We get started. Good afternoon. How are you doing?
Okay.
Great. My name is Lera Dent. I'm a student nurse practitioner at Columbus State University, and I will be doing your head to toe assessment for you today. Okay?
Okay.
Mr. Willie is a well-nourished, middle-aged male patient. He has good skin turgor. He's alert and oriented and cooperative with our procedure today. Now, I want to start off, like I mentioned, at the head. And we're going to go all the way through each system of the body, okay?
All right.
All right. All right. Let me begin also by getting your blood pressure while you're sitting there.
Okay.
I want to get it in both arms. Do you have any problems with hypertension or anything like that?
No.
Great. Your blood pressure is 170 in that arm. And we're going to get it in the other one. Right here. Yes, just rest it against the table. And your blood pressure is 94/70 in that arm. All right. I'll start
Okay.
with your head. Okay. I'm just going to start with inspecting.
Okay.
You have a normal scalp. Have you had any head traumas or anything like that?
No.
Okay. I don't see any scars or traumatic injuries or anything like that. And while we're here, we're going to just start with your lymph nodes, looking at your lymph nodes. And I'm going to start with your occipital, coming to the post-auricular, pre-auricular, submandibular, glossopharyngeal. I'm just palpating it to see if I feel any nodules or swelling or anything. Anterior cervical chain, posterior cervical chain, supraclavicular, subclavicular. And let's turn your head to the side to see if we get these. Turn to the other side for me also. Okay. Well, your lymph nodes are within normal limits. That's fine. You can hold your head now, Rick. I didn't feel any swelling or anything. And while we're here, let's stand here and get your weight for today.
Okay.
Okay, I got it. You're 219 and a half.
Okay.
That's good. Have a seat. Thank you.
Okay.
Now, I had washed my hands earlier, but I'm going to use a little bit of hand sanitizer this time,
Okay,
okay? Because I want to look at your eyes.
okay.
Okay. Let's look at your conjunctiva. Pull down. It's nice and pink. There's no problem. Your sclera is white. I see no jaundice. That's good. Okay. And we're going to check on your sinuses while we're working with your head.
Okay.
Do you have any problems with allergies or anything?
No.
Great. Okay, I'm going to do a little pressing. At any time, if you feel uncomfortable or feel pain, please let me know.
Okay.
Okay. So I'm going to just press here at the frontal sinuses. No pain.
Okay.
Good. Ethmoid sinuses. And maxillary along the cheek. I don't feel any puffiness or swelling at all. And let's see if we can bring the chair up a little bit, because I'm not sure if they see where I'm
Okay.
palpating. Now sit down. Let's see if that's going to be better.
Okay.
Yeah, I think that'll be better.
Okay.
Let me do your sinuses again.
Okay.
Okay, that's the frontal. You're a tall man. Ethmoids and maxillary. Again. And I want to be sure they saw the when I did your lymph nodes again too.
Okay.
Occipitals, post-auricular, pre-auricular, pharyngeal, maxillary, anterior cervical chain, posterior cervical chain, deep cervical chain, okay,
All right.
subclavicular, and clavicular. Okay, thank you. Appreciate it. All right. Now, next, we will be looking into your mouth. So I have a tongue blade, and I'm going to put on gloves.
Okay.
Okay. But I'm going to test your facial nerve first to let me know when you feel anything. Close your eyes for me. Let me know when you feel me touch you and where you feel me touch you. This test is to check the trigeminal nerve and the facial nerve. So let me know when you feel anything and where.
All right.
Where was it?
Top of my brow.
Okay.
All right. My jawbone.
Okay.
Underneath my cheek.
Okay, great.
My jawbone again.
Okay, good. Can you smile for me? All right. Again, that's the trigeminal nerve. That's good. Thank you. All right. Now I want to test your hearing, which is the olfactory nerve. Okay? I'm going to stand back and whisper a word, and you let me know what I said. Red.
Red.
Okay, thank you. All right, that tests your hearing, the olfactory nerve. Okay? And I want to go ahead on look in your oral cavity, open up and say ah.
Ah.
Okay, your uvula's midline, lift your tongue for me. Okay. All right, good. Close your mouth, that's good. And one more thing, that tested the glossopharyngeal nerve and the vagus nerve when you said ah.
Okay.
Now next I want to test the hypoglossal nerve. So could you do this with your tongue? Lick your tongue out first and then put it in each cheek for me. Great, thank you. That tests that nerve. So that's all intact. Great. And now we will move on back to the eyes again. Okay. Like I said, your sclera is white and your conjunctiva is nice and pink. Okay.
Okay.
And your nose. You having trouble swelling or
No.
with swelling? Any trouble smelling or anything?
No. No.
Let's go ahead on and check the olfactory while
Okay.
we're here. Could you close one nostril for me? Put your hand up
Oh,
there like
like
this.
this? Okay.
Yeah, close one and close the up. Breathe through it so we can see how open it is. Breathe through it pretty good. Okay. Do the other one. Okay. All right. You're breathing through it pretty good.
Mm-hmm.
All right. Great. Now close one for me completely. Close it off completely.
Oh, both of them.
No, one of them. And close your eyes. Because I want you to tell me what you smell, okay? Keep your eyes closed.
I smell something.
What does it smell like?
Lemon or alcohol or whatever. I don't know.
You don't know what it was? It was orange flavor.
Orange flavor.
Okay,
Okay.
yeah. Now I want you to close the other one and
Okay.
see if you can tell me what it is. Hold on just a minute. What was that smell?
I don't know. Couldn't catch it.
Okay.
Can't catch that. Still can't catch it.
Okay. Well, all right then. But that was coffee bean.
Coffee bean.
Yes, it certainly was. You didn't recognize it.
Mm-mm.
Well, that's okay. Well, that was to test your olfactory nerve. It does let us know that you do have some sensation there. And we will notate that you had some difficulty with distinction.
Mhm.
Okay? All right. Now, I want to check your vision again by doing the 6 cardinal fields of gauge.
Mm-hmm.
So what I want you to do is to just keep your eyes on one object. You know, so your head will stay in a certain position. Just look right there at this little yellow thing right here. Okay?
All right.
Okay. Now, without moving your head, I want you to follow my finger right here. Now, without moving your head. All right, that's good. Now, without moving your head again, I want you to tell me, I'm going to go behind you. Just keep looking directly and tell me when you see my fingers.
I see it.
Okay, good.
See it.
Good, okay. Keep your head straight.
See it.
Okay, that was the test for your peripheral vision. Okay, great. All right, now the next, while we're still in this area, is I want to check your trachea, okay? All right. It's midline. Okay. Now, I'm going to check the thyroid also while I'm here. So I'm going to be touching on you. Can you swallow for me? Good. I don't see anything that would indicate a thyroid nodule or anything. That's good. All right, now that we have finished checking your optic nerve, your abducens, and your oculomotor and your trochlea, we will move on. That 6 fields, cardinal fields of gauge was to test that. So that's within normal. All right. I think we have pretty much finished everything around the head area. But I would like for you to shrug your shoulders for me. There's one more nerve we can check. Do this. Shrug your shoulders for me. Yes. Yes. That checks good. Shrug it up and down. Okay. All right. Good. And turn your head. Okay. Turn it against my hand. There we go. And again this way. That checks the spinal accessory. Okay, now relax. That's great. Thank you. All right, now we're going to move on to your chest area. I'm going to be listening to your heart and your lungs. Okay, and I'm going to give you a little bit of direction while I do that. Okay? All right, I'm going to pull the gown down just a little bit. That's fine. I'm going to listen to your aorta. Pulmonic. Second pulmonic. Tricuspid, and your mitral valve. Okay. All right then. And I'm also going to listen to your jugular vein, okay? I'm listening for bruise, so I'm going to listen again with the bell.
Okay.
Okay, I didn't hear any bruise. That sounds good. Give you a little bit of privacy there for me. And I also want to feel your carotid pulse and your apical pulse simultaneously to make sure that they beat at the same time, okay? And they do. Nice, strong heartbeat. Okay? And while we're doing the pulses, let me go ahead on and check the rest of them.
Okay.
On both sides, you have 2 carotids. You have 2 brachials. I'm going to check those. Your radials. You pop your heel, stretch your legs out a little bit.
Okay.
Air behind the knees.
Mm-hmm.
Dorsal tibialis. Dorsal tibialis. Posterior tibialis. I'm sorry, I said posterior tibialis and dorsalis pedis.
Mm-hmm.
Okay, they're nice and strong in both areas. Okay,
Okay.
relax a little bit. Trying to think what else we need to do in this area while we're on cardio. I'm just going to move on to your lungs now. Listening to those, I will need to listen to those in the front and the back also, okay? Take a deep breath, blow it out. Okay, that's good.
Again.
Yes. Again. Okay. Again. Okay, good. I want to listen up the right middle lobe. Deep breath. Okay. Good. All right. And I was reminded while I was there that I did not check your axillary lymph nodes, so I want to do that while I'm here. Okay?
Okay.
And those are located under your arms.
Yeah.
So if you would, just raise this arm up for me,
Okay.
up high, so I can check your axillary lymph nodes. Okay, that's good. And this arm.
Okay.
All right, good. Trying to maintain your privacy, everything all at the same time, and give you a good examination. Okay, now I want to listen to your lungs in the back.
Okay.
Okay? Take a deep breath for me. Out. Again. Good. Again. Okay. And again. All right. Okay, don't hyperventilate.
Okay.
I can hear just fine.
Okay.
Okay, good. And I want to do another test that's called tactile fremitus. So I'm going to be putting my hand on your back, and I'm going to do it in the front too.
Okay.
And when I place my hand on your back, wait 1 second and say 99.
Okay.
Okay?
Okay.
Say
99. 99. 99.
good, very good. Now I'm going to do it in front.
Okay. 99. 99.
Good, okay. And while I'm here, I'm feeling around for any crepitus. I don't feel crepitus. Okay, good. Now, let me just think, is there anything else in the respiratory system that we didn't do? Thoracic expansion, and I didn't. That's what I want to check for, your thoracic expansion, but I need a marker and a tape measure. Okay. Sit straight up for me again.
Okay.
And I'm going to take a deep breath, and I'm going to watch how my hands spread. Okay? Good. Thoracic expansion is within normal limits. And okay, I'm going to measure it also, okay? So I will be checking for resonance when it first starts. Okay.
Okay.
Can you take a deep breath and hold it? Can you? Okay, exhale. There you go. I got it. Okay. Now this time, I want you to take a deep breath and blow it out to get rid of all the air. Take a deep breath for me and blow it out. Now, okay, blow it out. All right. Now, I want you to do that again for me and just keep blowing out and don't come in. Do it again. Just keep blowing out. Just one time, one long blow out.
Okay.
Okay, come on, let's do it again. Okay, now blow out, long time. Blow out, okay. Relax, I got it. Okay, that looks to be, I need to measure this. Just breathe normally now. The thoracic expansion is about 3 centimeters. That's good. All right, you breathing normally?
Oh, yes.
Good, okay, great. Now, even though you are a male, men need to do breast examinations on themselves. Okay, I'm going to show you how to do that. I already checked in your axillary lymph nodes, so I'm just going to remove one sleeve here. Take your arm out for me. All right, now relax. Now you need to do with this hand, what you need to do is just check your breast tissue, starting from an angle and move over and come down to check all your breast tissue. Move over just a little bit more and palpate up and down. Move over a little bit more to palpate up and down all the way to the nipple.
Okay.
And go around the circumference of the breast doing this, okay? You need to do that once every month. A good time to do it is when you're in the shower. Do you see the distance I'm moving?
Yes.
Just a little bit at a time to be sure you don't miss any lumps or anything in there.
Okay.
Because that's how breast cancer is detected, okay?
Okay.
All right. I think we're pretty much done, finished the heart and the respirations. Now let's move on to the abdominal system. Okay?
All right.
So what I need for you to do is to, let's see if we can get on the table.
Okay.
You think it'll hold us?
Yes, it should.
Okay, all right then.
Which way you got?
Just relax. Head that way.
Okay.
Just relax. Okay. I'll try not to keep you on here too long. I know you're tall. You can slide down just a little bit more to be comfortable, okay?
Okay.
All right, that's good. Is that pillow good?
Yes, I'm good.
All right then. I'm going to lift this up. Okay?
All right.
All right, let's put it down there. I'm going to begin by inspection first. Okay?
All right.
And I see where you've had the surgeries here. And we won't be putting all your business on YouTube. So, but I'm going to listen to your bowel sounds, okay?
Okay.